everybody. My name is John Blanchard, and today is March 24th and day 2 in what I'm calling the COVID camper. I call it the COVID camper because it's affectionately my home until this viral pandemic is over with. I'm a family physician, and I didn't want to bring the virus home to my family, so I moved into this camper. I'm doing these videos. I'm going to do one each day as an attempt to get good information out to the public. There's a lot of misinformation on the internet, and I think it's really important that people have access to accurate information about this virus. The information I give you is from trusted sources, the CDC website, University of Michigan advisories, and Beaumont Hospital advisories. When I do these videos, I'm going to cover 3 questions that I'm getting during the day or through our Facebook page that people are asking. I'm going to talk about one thing I'm grateful for. I think it's really important that all of us, not just during a viral pandemic, but all of us every day count our blessings and count the things that we're grateful for, because a lot of times we don't think about those things in our daily lives. The other thing that I'm going to talk about is something that I hope is positive that comes out of this viral pandemic. And then finally, I'm going to talk about how DPC works for me, and maybe how DPC can work for you. So let's start with the 3 questions, 3 COVID questions. So the number one is, people are asking, what are the real numbers nationally? How many people have this virus? Well, according to the CDC, 44,183 people have tested positive in our country for the COVID virus. It's thought that there could be as many as 10 times more than that have the virus, as we talked about in the video yesterday. We don't have enough tests to test everybody, so it's estimated there's quite a bit more people in the country that have it, but just haven't been tested. Of the 44,183 tests that were positive, there have been 544 deaths. So one of the things that people have asked is, how does this virus compare to the flu, and is it more deadly or is it not? The 2 viruses are both serious, but COVID tends to be more of a serious virus. The influenza affects 34 to 49 million people since October. So from October to February 29th, that many people have been estimated to have the flu. 350,000 to 620,000 have been hospitalized, and there's been 20,000 to 52,000 deaths. So when you look at the gross numbers, one might think, well, boy, the flu is more deadly. But remember, the flu is affecting a lot more people. We didn't shut down air travel, we didn't shut down schools, we didn't shut down businesses for the flu, and so many more people contracted the virus, and as a result, more people passed away from it. So the flu is very serious. You should get a flu shot every year, but don't let these numbers, because there's smaller numbers with the COVID virus, don't let that make you think that this virus isn't serious. It is serious, and something that we have to watch very closely to see how this plays out over the next coming months. Another question that I'm getting is, should I be taking chloroquine? There has been some evidence that chloroquine has effectiveness against the virus. There are hundreds of protocols being tested around the world on how to treat this virus. Chloroquine is part of those protocols, but there's also antiviral medications that are being used. The government has restricted the distribution of chloroquine from pharmacies because they want to use those medications and reserve them for people who are the very sickest, the people that who have life-threatening illness from the COVID virus. So you can't get it from the pharmacies, and I wouldn't recommend asking your doctor for it or trying to get it in some way. It's not a miracle drug, and it's a medication that if it does prove to be helpful, that we want to use that for people that are seriously ill. Another question that I'm getting is, should I use Tylenol or Motrin? At this point, it is recommended that you use Tylenol if you have fever, but if you don't have Tylenol, you can use Motrin. It's just best to try to use Tylenol as a first option. There's rumors going around that questions about should I stop my blood pressure medicines, or specifically two medications called ACEs or ARBs. These are blood pressure medicines that are commonly used. And there's a theory that these medications may increase the receptors in the lung and thereby increase the risk from the virus. It's only a theory right now, and it's all the professional organizations that I've been able to find in reputable sources recommend not going off of your blood pressure medications, and that's my recommendation too. Everybody should stay on their blood pressure medicines. If you're on an ACE, if you're on an ARB, stay on those. I'm watching this closely, and if there's any new developments, I'll be sure to let you know in these videos. But stay on your blood pressure medications. There's actually can be a lot more risk by going off of them than the blood pressure going up and increasing the risk of heart attack or stroke. So you want to really stay on those medications. Moving on to something that I'm grateful for. What I'm really seeing is something I'm grateful for is the private sector really stepping up to help the healthcare industry, help healthcare professionals, and as a physician, I really appreciate that. I'll give you a couple of examples. My next door neighbor works for GM, and GM is really ramping up the production of personal protective equipment, the masks, the gowns, the shields, those types of things, which is very much needed in our setting to help protect us against the virus as we're treating patients. They're also really working hard to ramp up the production of ventilators, which is really important in the treatment of this condition because it can lead to respiratory failure and distress. Another example is my nephews, who have a small manufacturing company here in Michigan, and literally in a few days they created a prototype protective eyeglasses and face shields that they were very quickly able to bring to market and begin mass production to get them into the hospitals locally here in Michigan. This type of thing is happening all over the country, and I think it's something I'm just tremendously grateful for as a physician that private companies are stepping up to fill this need that we have right now. Something that I hope that is positive that comes out of this this viral pandemic is that, you know, a lot of times in life we have relationships that break down, communication breaks down, boundaries are stepped over, and the relationship can suffer as a result of that. Oftentimes, sometimes those things are not as important or as big as we make them out to be at the time. When we're dealing with something like a viral pandemic and how serious it is, I think sometimes that can put it in perspective, and maybe we need to reflect on some of those relationships that we have and work toward better communicating and setting up healthy boundaries in those relationships that are so important in our lives. Finally, one way that SALTA Direct Primary Care works for me, and what I'm grateful for as a direct primary care doctor, is that we're able to continue to take care of patients during this viral pandemic. We have 6 offices. We take care of 8,000 patients. We've been able to virtually in a week move all of these patient visits into the virtual environment by doing phone visits, by doing video visits, by doing messaging with our patients through MyChart, Beaumont's MyChart. And in fact, we've done, as an organization, 993 visits this way since March 1st. So I'm tremendously grateful that we can continue to serve the community in this really important function that primary care has in keeping people at home, if they in managing them at home, but also being able to bring them into the office. Our offices are open to see people who have urgent or acute needs, or even respiratory difficulty from the COVID virus, to see whether we can keep them at home and continue to treat them there, or if they need to be triaged to a higher acuity facility like the emergency room or the hospital. A lot of primary care offices are struggling right now because their income is based on, their revenue is based on patient visits, the number of visits they see each day, and we're telling people to stay home, to not come into the office, so the patient volumes drop, and private practice primary care doctors have a hard time paying their staff. They've had to often close their offices and not be able to see patients. So I'm really grateful that as a direct primary care doctor, we've been able to keep our doors open and maintain continuity of care for our patients in the community. If you want to learn more about direct primary care, you can check us out on Facebook.com, SALTA of Clarkston, or Facebook.com/SALTA of Troy. If you want to learn more about direct primary care, you're welcome to call Kyle at 248-922-3076. Kyle will be happy to answer all of your questions about direct primary care and find out if SALTA DPC can work for you. Again, thank you for watching. Be safe out there. Take care of each other. Love each other. And today is day 2 in the COVID camper, and I'll be back here again tomorrow for another update. Thank you very much.